Get started. My name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I have been practicing here in Boston for the last 5 years and recently opened my own practice. I've also been teaching with the Community Online Academy since its beginning. So we've had a lot of fun over the past couple of weeks, and this program continues to develop. This class specifically is about back pain. It is going to be mostly movement-based. We have some stretching, some strengthening. We'll talk a little bit today about the timing of exercise and how and why you decide to do certain exercises, and then certainly save some time for questions at the end. One thing I want to emphasize before we get started is that you know your back better than I do, and we are all dealing with slightly different things in our bodies. Please listen to your body, and if something doesn't feel right, take a modification or take a little rest. I offer a lot of different options for how to modify these exercises, so please don't be afraid to take that for your body. So with that being said, we will get started. And Sean, I think the spotlight is on your video right now. If you can switch that over to mine. Awesome. Okay. All right. So we will get started here with your small pillow and lying down on your mat. So just find a comfortable position to rest your head down. Feel the heaviness of your hips and your feet down onto the mat. What we're going to do is place our pillow underneath our sacrum. The sacrum is the bone between your low back and your tailbone. It's a flat bone on the back of your pelvis. So you're going to lift your hips up, place that pillow underneath your sacrum, and it should be under your pelvis, not really under your low back. And so the point of this is just to lift your hips up a tiny bit. And if you've taken my foam roller class before, you've done this little release of the low back. So we're going to start here in this moment, allowing our spine to very gently decompress. So over the course of the day, just because of gravity, our spine experiences low levels of compression. By lifting our hips up a little bit higher than our heart, we get a very gentle, mild decompression. And that can help us to start to deepen our breath. So I ask you guys to take your hands right on top of your rib cage and feel your rib cage start to open up as though your lungs are a balloon that you're inflating with a big breath in, and exhaling. Feel the air leave that imaginary balloon and feel your rib cage close down. Now, if this is the first time you're practicing this deep breathing today, you may not feel a lot of movement under your hands, and that's okay. Give yourself a little bit of pressure into the front of your ribs so that your brain can connect and start to open up the ribs and belly and let it go. So we focus in on our breathing in this position because it's one of the first ways to create movement through our thoracic spine, which is our upper back, but it does meet our lower back. And then to help strengthen the muscles that support our spine. It also just feels good. It's a nice release for our body. So we'll try a couple more like this. And I'd like to show you guys this position. I sometimes get questions about whether or not people should get inversion tables where they hang upside down at home to stretch their back. This is like the most mild, most gentle version of that, but it doesn't cost anything. It doesn't take up a lot of space. If this is something that helps you, use it throughout your day. So we'll try one more big breath here. And then let it go. So very gently, we're going to lift the hips up and slide that pillow out from underneath your hips. Just let your tailbone rest down on the mat. And then we're going to take that pillow, and depending how thick your pillow is, I'm going to fold mine in half to place it right between my knees. So what we're going to work on here today is our hip flexor muscle. So I hear a lot of times people have this tension and tightness in the front of their hip flexors that just doesn't go away. They stretch and it's still really tight. Part of the reason is that we tend to overuse our hip flexor muscles. And our hip flexor muscles actually attach to our low back. So sometimes overusing those muscles puts more stress on our lower back. So if you're not sure where your hip flexor muscle is, You're gonna feel right at the front of your hip, lift your leg up, and you will feel kind of a thick tendon tighten up underneath your fingertips. That is your hip flexor tendon. So once you know where that is, you're gonna keep your fingers right on that tendon and try and squeeze in on the pillow. So as you gently hug in on the pillow, this is an exercise for your inner thighs, your adductors. But I think many of you will find a glimmer of your hip flexors trying to work here. And if they're not working at all, you feel them totally quiet, kudos to you. You can try this gentle squeeze in and then release. If you're still feeling the hip flexor, it's hard to turn them off. Try tipping your tailbone towards your feet just slightly and making your squeeze a little bit more gentle. So it doesn't have to be the hardest squeeze you've ever done. And see if you can quiet the front of that hip flexor tendon. At the same time, notice if you can do this squeeze equally with both legs, or do you feel one leg and then the other leg move in? Try and create symmetry between your two hips here. Good. Exhale, squeezing in, inhale to release. We're gonna try 3 more just like this. Good. Last 2 more. Excellent. And one more time, we're gonna hold that gentle squeeze in. From here, we're starting to lift the hips up into a bridge, drop the hips back down, tap the mat. Exhale when you lift up, and inhale, tap back down. So if you've done this exercise with me before, this is a bridge. This is meant to strengthen your glutes, your butt muscles. And our glutes play an important role for our spine to help support us when we squat and when we bend over. A lot of times in this position though, people have trouble feeling their glutes. And that is often because even in this bridge position, our hip flexors are trying to work. So one of my favorite tricks to reactivate the glutes is to add this very gentle squeeze in between the knees. So you can go ahead and try and feel that here. You can even bring your hands to your butt muscles just to make sure that they are working, or keep your hands on the front of the hips to make sure your hip flexors are not working here. We'll try 3 more just like that. Beautiful. Last 2. Good. Try 1 more time here and drop the hips back down, take a little rest. Okay, so we're gonna go into a little bit of abdominal work here. Now this one is tricky for those hip flexors because they like to do the work of our abs as well. So we're gonna take the pillow out for just a second, lift our legs one at a time to a tabletop position, which is where your knees are right over your hips. And then we're gonna replace that pillow. And you can do it the short way, or you can double it up and make it a little bit thicker, whatever is more comfortable for you. In this position, see if you can do those squeezes again. And this is a little bit trickier. If you get here and you feel those hip flexors firing right away, see if you can press your rib cage down into the mat. And if you feel like, nope, it's still on, come back to this start position with your feet down. Once you feel like you can get your legs lifted, try then pressing the legs out straight and bending them back in. The modification is to push up a little bit higher to the ceiling, and the challenge is to push down a little bit lower towards the floor. But as you press, see if you can keep that gentle squeeze in the same on your legs, both when you straighten and when you bend. And this can become quite intense. And we work on our core, of course, because it is what supports our spine in all types of movements. We'll try 2 more here. Good. And 1 more time. Bring it back in, drop your feet down. You can place that pillow off to the side for the time being, and very gently just rinse your legs from side to side. It's okay for your hips to lift in this pattern, but try and keep your rib cage down as you rotate your legs from side to side. So we'll settle somewhere right back in the middle. We're gonna try 1 more exercise for abdominals, this time with some single leg work. So we're not gonna have the pillow here, but I want you to imagine that it is still there, that your inner thighs are still active. So arms pressed down by your side, This time, reach both legs up to the ceiling, and you can keep a soft bend in your knees if your hamstrings are tight. From here, we're gonna drop one leg down to the floor, lift it right back up to the ceiling. Slowly drop the opposite leg down to the floor, lift it up to the ceiling. You want to drop the leg down only as far as you can keep your spine still. So if you imagine your morning coffee balancing onto your stomach, you don't want to disrupt that as you switch your legs from side to side. Like I said, having that soft bend in your knee is fine, and your range of motion might be really small. It might be just a couple of inches like so. Good. 2 more. And last time, good. Hug both knees in towards your chest. Give yourself a gentle stretch and see if you can roll yourself all the way on up to a seated position. We're gonna flip on over now onto an all fours setup. If you have any knee sensitivity, this is a great place to grab that pillow. You're gonna place it right underneath both of your knees. From here, hands will find themselves right underneath our shoulders. We'll go through a few cat-cows, allowing your head to hang down, and then dropping your shoulder blades together, lifting your heart, lifting your head. Allow your head to drop down, draw the rib cage up to the spine, and head lift. Make this movement comfortable for your body, your biggest or smallest range of motion that works for your body. We'll try 2 more. Good. And one more time here. Good. Now, from this position, we're going to lower down onto our forearms. So we're in this decline setup, but my elbow is still right over my shoulder. Notice how your rib cage can sag to the floor. Try and lift up to find that flat back position, and then keeping your weight evenly distributed in both arms, reach your left leg back behind you. And I'm going to scoot forward just a little bit so you guys have a better view. Left leg is straight back behind you. Now, chances are a lot of body weight shifted to the right side. See if you can center yourself. Keep your neck long, straighten that left leg back behind you, and now tap the floor and lift. Tap the floor and lift. So this exercise doubles as a little bit of core work as well as a little bit of glute work. So a combination of those 2 things we just practiced. Good. 4 more. That's it. Last 3. Lift up. And 2. Keep shifting your body weight to the left last time. And bend the left knee in. Take a moment to reset, drawing the ribs up away from the floor, and straighten the right leg back behind you. Now, if your body shifted to the left, redistribute that weight over to the right side. Keep that right leg totally straight back behind you and start to lower and lift. Lower and lift. Keep your shoulders down away from your ears. Can you reach your neck long as though you're a turtle sticking its head out of its shell? Good. 3 more. And 2 more. Last time, lift up, bend your knee down, press yourself on up for just a moment, and then place your pillow just in front of you. We're going to do a little stretch for the upper back by placing our elbows down onto the pillow, still in this all fours position, and then shifting our body weight backwards to drop our head down, maybe even resting your head on the pillow. And then you have an optional add-on here to bend your elbows to tap your upper back. And you should feel a nice stretch in the back of your shoulders. So think the way that a dog might stretch their paws in the morning. This is how you want to flare your tailbone up to the ceiling and press your hips back, feeling a nice stretch through that upper back. The arms are an optional add-on here if you would like. We'll take 1 more deep breath in this position. And then carefully come on up. We'll set that pillow off to the side once again. We're going to lower all the way down onto the floor, this time separating the feet just slightly wider than hip distance with the hands under the shoulders, the elbows in by your side. Keeping your feet down, you can start to press on up to lift your upper back, and maybe press all the way up to lift your lower back. So whatever you feel comfortable with, range of motion is fine here. You can make this as big or as small as you feel comfortable with, but work on making the upper back lift just as much as the low back. So instead of having a flat spine here, you're drawing your shoulder blades down and together to open your heart forward. And if you feel pinching in your lower back, just separate your feet a little bit wider than hip distance and make your range of motion slightly smaller. But my hope is as you practice this a couple of times, that you start to get a little more range of motion with more comfort. We'll try 2 more here. Beautiful. And one more time. And lower all the way down. This time, we're gonna roll onto our side. So I'm on my left side here. If you guys want to follow along exactly, you're gonna make a little pillow with your bicep. Keep your bottom left leg straight. And then I'm gonna fold my pillow in half here, bending my right leg to rest on top of the pillow. So my top leg is bent, resting onto the pillow. We're gonna go into an upper back stretch. And this is a stretch to increase the rotation of the upper back. Our upper backs actually are the place where we tend to have a lot of stiffness. And so that stiffness can put more stress on our lower back. So that's why we work on it here. So we're gonna take that top arm, reach it to tap the floor in front of us, and then reach back and over for the floor behind us. Now, the reason I give you the pillow here is if when you rotate back, you feel your knee lifting off the pillow, that's meaning the stretch going into your low back. So you want the stretch to stay in your upper back. So you're gonna rotate only as far as you can, keeping your knee down on the pillow. And so that may limit your range of motion a little bit here, but that's okay. That's gonna focus the stretch just into the upper part of your back. And if you have any shoulder sensitivity, you can bend your elbow and just rest your hand on your chest, trying that same rotation movement. So really this movement is coming from the rib cage. The shoulder is just an added benefit here. Good. We'll try 3 more just like this. That's it. And 2 more here. Excellent. And last time. Good, and we'll come back through the center. We're gonna remove this pillow, bending the bottom leg and straightening the top leg. So from this position, we're gonna do some strengthening for the side hip muscles. So in this position, reach your top leg so far away that your bottom rib lifts off the floor. And we're gonna draw tiny circles. So notice that my right leg is staying totally straight. The circle is actually happening from my hip joint. So my hip joint is a ball and socket joint. So you can imagine that ball sliding around in the socket to create that circular motion. As you circle, your spine is totally still. Change direction. You should start to feel the muscles on the outside of your hip work. Those are the muscles that support your pelvis from dropping when you walk and when you run, and certainly when you're, moving around, carrying heavy things. We'll try 3 more and 2 more. Last time here. Beautiful. So bend both of your knees. Press yourself on up to a seated position. So now I'm sitting down on my left hip with my legs splayed off to the right. And if this is super uncomfortable, you can adjust your legs to any position that works for you. But we're gonna add in one last spine stretch here, which is to side bend and reach my right arm up and then place it back down. So I'm placing my left hand on the floor, stretching my right arm up and over and place it back down. Now, for those of you who wanna make this a bigger stretch, and add in a little strength component, you're gonna start to stretch your legs long, lifting your hips up into an arc, and then lowering back down. Now you have the option to just stay here with this side bending stretch, but you are more than welcome to try that stretch out and lift up, finding that long arc with your spine and lowering down with a little bend. We'll try 2 more here, just like this. And lower all the way back down. And 1 more time here. And lowering down, bending your knees. Good. We're going to swivel those legs up and over to the other side. Now lying down on our right side body, and just grab that pillow, have it nearby. You're going to make a little pillow with your bicep. Straighten your bottom right leg, and then bend your top left knee to rest down onto the pillow. Okay, so we're going into that upper back rotation stretch here. So that top arm is going to reach out in front of you and then back over, reaching for the floor behind you. You may or may not touch the floor behind you, and that's fine. You're working within what's comfortable for your body without allowing that top leg to lift off the pillow. Good, and again, you have the option to modify with your elbow bent, chest, hand resting on your chest, and just rotating to open and close from here. So whatever position is comfortable for you is fine. Again, we're using this stretch to help open our upper back, to keep our upper back flexible, minimizing the stress that we feel on our lower back. And you've probably done this stretch with me before. If you've taken one of my classes, it's called book openings. You can imagine opening the page of a giant book and then closing that page. And you can follow your top hand with your eyes if that feels comfortable here. Good. 2 more just like this. That's it here, guys. Excellent. And 1 more time. Good. And close it down. Awesome. So we're going to go into that side hip strengthening. So we'll set off our pillows. This time you're bending your bottom right leg, reaching your top left leg out long. Once again, make sure that top left leg is straight, and then start to draw your circles. You can keep your hand on the front of your rib cage to make sure that your spine is not rocking front to back. And the reason is that we want our spine to stay still so that our hip can do the work. This is a hip exercise, not a back exercise, although it does benefit our back to have strong hips. We'll try 3 more. 2 more, beautiful here. Last time we'll reverse those circles, same thing. Good, so again, you're starting to feel those muscles on the outside of your hips start to warm up. Think about really tracing a true circle. So not just up and down, but reaching in front and back and all the way up and around. Good, 4 more and 3 more. That's it, last 2. And 1 more time. Good, bend your knee, place your legs down to stack, and gently press yourself on up to a seated position. This time sitting down on your right hip with your legs splayed off to the left. You can place your right hand down on the mat, and you're going to reach the left arm up and over, and you're stretching the side body on your left side. And then we come back up, and again we dive over, reaching that left arm over. We'll try at least 1 more time like this, and you have the option to stay with this set if that's comfortable for you. Otherwise, you can add on that side plank by stretching your legs long, reaching your hips up to find this long arc, and then lower your hips down, dropping down. Now, this should be within your comfortable range of motion, which may be different than mine. It may be different than your neighbors. But think of using this top left hand as a rainbow to reach up and really arc over and then drape back down. Good. We'll try 2 more times here. Reach up, over, find a big stretch, and lower back down. That's it. And 1 more time like this. Good. And you can come all the way back down, shake it out. So I've had a few questions in my past couple of classes about what is a good stretch I can do in standing. So we just did that really nice side bending stretch. I like that one a lot for all different types of back pain. So I want to show you a quick, easy way that you can do that in standing. You do need a wall. So if you don't have one nearby, you can always try this exercise on your own later. I'm just going to tip my camera up a little bit so you guys can see. So if I were to use my wall space here, what I'm going to do is stand perpendicular to the wall, place one hand on, and reach my spine up and over. So I'm bending sideways. So from the front, it looks like this, that same sideways stretch, but you're using the pressure of the wall, just like you might with your hand on the floor. And so in the opposite direction, I'll use this wall here. I'm going to place my hand into the wall, feet are firmly planted, and just bend my spine sideways. Now notice if you're also bending forward or also bending backwards. That can be uncomfortable for your spine. You want to move purely in this sideways direction. So I like to imagine that I am standing in the panes of a toaster and then trying to bend without touching either side of the toaster. Good, and you just take a gentle breath there. So that's a quick little tip. If you had just like 30 seconds to add in a stretch during your day, that's a really nice, very easy stretch that you can add in without a lot of equipment around. So what I wanted to talk about today is why to do certain exercises at certain times. And really there is no one perfect time to do this type of stretching routine for everyone. So I really like to categorize people in kind of two types of back pain, and that's a huge generalization, but it may help you to orient when the best time for you to do these stretches are. So some people, and I would put this more in the category of arthritic type of back pain, they go to sleep at night, they sleep and they wake up and they're in a lot of pain. They wake up, they're stiff, they're sore. As they get going through the course of the day, they start to feel better. Their back actually feels better as they move a little bit more. That type of back pain would really benefit from doing this class early in the day. So maybe even right as you get up, you go through a couple of these stretches that work well for your body, and then you go about your day. And that way you feel a little bit better earlier on in the day. Otherwise, I also see patients who they wake up in the morning, they feel awesome, they're going about their day, everything's good. But as the day goes on, maybe they've been sitting for a little while or they had a commute to work, their back pain gets worse and worse and worse. And by the end of the day, they're in a lot of pain. For those types of patients, they may be dealing with more acute disc problems or muscle aches, muscle tension. Those kinds of things may benefit from doing this stretch either integrated throughout the course of the day or more towards the end of the day. So maybe you do a couple of these stretches at lunchtime and a couple of these stretches when you get home from work, or a couple of these stretches every 2 hours throughout your day. That way you can sort of get ahead of that really cranky back pain that you get at the end of the day and work in these stretches to just manage the symptoms you develop over the course of the day. So I hope that gives you guys a little bit of a better picture of why you might be having certain symptoms at certain times and how you can take today's program or even programs from the previous weeks and apply them to your life to get the most benefit for your body. So with that being said, I know that there are probably some questions out there. I would love to take a few minutes to answer your questions. Go ahead and write them into the chat. I'm going to read through all those questions. I'll answer a few. And then if you guys have a moment to stick around, we will show you how to use the feedback app to leave feedback about this program. So let me come in a little bit. I see there's already a lot in the chat. Let me go ahead and read through those. Okay. So there's a question here, are the hip flexors supposed to stay relaxed? That's a good question. So I talk about the hip flexors and kind of calming the hip flexors down in this class because I think in general, they get overused. But that's not to say that you should not use your hip flexors. Our hip flexors are super important to our body to be able to lift our leg up. That's their function, is in standing to pick our leg up, which we do when we walk, we do when we climb stairs and all those things. So our hip flexors are important to work, but I find that they often work during other types of movements where they really don't need to work, like that bridging exercise or some of the core exercises. So it's just something to get you thinking a little bit, but it's okay to feel your hip flexors working at other times during the day. Okay. So here's another good question here. By the end of the evening, my back is clicking. Why is that? So any clicking or popping in your back really is a normal thing. It's not a bad thing, but it's something to note. And what we worked on today were some of those deeper core muscles that support your spine. If you notice that your back is clicking by the end of the day, it's usually a sign of weakness or lack of endurance in those abdominal muscles. So by the end of the day, they are getting fatigued and they may not be able to support your spine. So what happens is each little vertebrae moves maybe a little bit more than it should, and you'll hear sometimes a click or a pop.